Welcome to the What's Happening Birmingham video podcast.
This podcast is brought to you by the Jefferson County Department of Health.
We're all tired. COVID fatigue is real, but we can't quit now. Until a vaccine is available during this cold and flu season, it's more important than ever for everyone to practice the 3 W's. Wash your hands, wear a mask, and watch your distance. Stay at least 6 feet from people outside of your household. Most important, if you feel sick, stay home. This holiday season, let's spread joy, not COVID-19. A message from the Jefferson County Department of Health.
Hello, everyone. This is Jarvis S. Scott with What's Happening Birmingham. Today, I have the honor and pleasure of having Dr. David Hicks. He is the Deputy Health Officer of the Jefferson County Department of Health. Dr. Hicks, thanks for coming on the podcast today.
Hey, man, I'm excited about it.
Great. So you've probably seen this man's face, video, along with other great doctors of the Jefferson County Department of Health running their PSAs on my podcast, and you've seen on social media, television, everywhere they can to get the word out about COVID-19 and also just providing, regular health updates. So I want to bring the doctor on today to kind of talk about a lot of things, but let me first start off today. Let's talk about the numbers currently of December 22nd. So in Jefferson County, we've had 46,794 cases. In Alabama, we've had 329,811 cases. And of course, the deaths, 616 here in Jefferson County and 4,452 here in Alabama, which regrettably, those are numbers we never wish would ever even have occurred. And what we're trying to do today is keep information out so we can reduce these numbers from going. So let me first ask you, Dr. Hicks, is, of course, thing we've been hearing is about the COVID-19 vaccine coming, around the country. What's the latest update concerning the vaccine here in Jefferson County?
Yeah, so, last week we got that exciting news where we got that first vaccine, the Pfizer vaccine first hit. We were getting about 10,000 doses. And then this week right here, going into next week, we're expecting to get Moderna vaccine. That's the second one that's been approved. There's really no difference between the two, just different company makes them. They're made about the same way, same safety, same effectiveness, all that stuff. So what happens is we're starting to get the vaccine, which is our true kind of light at the end of the tunnel to get out of this pandemic. We need at least 70% of everybody to get vaccinated, but it's going to take a while because we were waiting for all the new supply to start trickling and coming in. And we have to, because we have limited supplies right now, we have to allocate the vaccine to the people that are at the highest risk first. So the general public is not able to get the vaccine yet. You got to wait your turn, but it's because we only have limited doses and we got to protect the ones that are most vulnerable.
Okay. And of course, I know everybody's been, you probably have some people that's been willing to get this, but you also have had people who are saying that they do not want to get it at this time. So another reason I want to bring the doctor on today is let's talk about the myths. Let's get everything out there. The first myth I've heard is that it's not safe and that they're rushing it too quickly.
Yeah. So let's address that. Let's talk about this. So safety wise, both vaccines are basically 95% effective.
Mm-hmm.
For safety, what happens is when you get that vaccine, this is what you should expect.
Mm-hmm.
You're probably going to have some achiness. You might have a little bit of swollen lymph nodes on that same side where you got the shot at. You may feel, tired and maybe a little feverish. And it's similar. Think about when you hear about some people, they said to get the flu shot and they feel a little ill. That could happen. So we're not trying to hide that from people, but that only is temporary. It lasts for like 2 days maybe, and that's it. That's not going to be in everybody, but some people will get one or a few of those. Now, that is not from COVID in your body. The vaccine cannot give you COVID, but it's your immune system showing you that it's working. We put the vaccine in your body, your immune system says, I'm recognizing something foreign that's not supposed to be here. Then your immune system really gets kind of ramped up. And that's why you feel that. Now, as far as like a serious side effect, there's nothing serious, nothing to be majorly concerned about. If you've had a severe allergic reaction to a vaccine in the past, or an allergic reaction to any component of the vaccine, then you should not just jump to go get the vaccine. That's the only people we're telling you, talk to your specialist doctor before you even get the vaccine. Otherwise, there's no serious things that have been reported. There was one of the myths that came out was about somebody died, after getting the vaccine, and that was circulated when the first day the vaccine was hitting, and it was a lie, but it was spread through social media, and that really damaging. So right now, from a safety perspective, there's nothing that has us of any concern, but we're still going to be monitoring safety continuously. Because there's been about 40,000 people already in the United States in the vaccine trials that have gotten vaccine. And so we know about them already. And then as more people getting vaccinated, we're going to be hearing more from the days to come. So if anything that's not right or something of concern, everyone will be able to hear that right when it happens.
What are your concerns as far as pregnant women? How at risk are they?
So you said pregnant women?
Yes.
Yeah, so pregnant women are at very high risk of having complications from COVID. So when we're rolling out the vaccine, and we'll maybe get into this a little later, the first group of people is the frontline healthcare workers. If you're a frontline healthcare worker and you're pregnant, we absolutely recommend that you get the vaccine. We still, though, would say go talk to your OBGYN doctor first. But there's no reason if you're pregnant to not get the vaccine if you're in that group that we're going through, like the frontline healthcare worker, or say you're a EMS provider, like a first responder, you should get the vaccine.
All right, well, let's dispel and put two rumors out. And, as people watching this video, one thing they know is me and you both got in common is we're the same color skin. What things are you all doing to kind of dispel the myths that, have been a big distrust, in the African-American community concerning vaccines, and trying to implement this to get out to the African-American community?
Yeah. So, I feel first we got to be honest and say, we know that the medical profession has done wrong by people of color for many, many, many years. Okay. Tuskegee syphilis studies is one example of many wrongs that have happened. So it's absolutely understandable that communities of color are a little nervous, saying, should I trust this happened in the past? Is this going to be a repeat? Okay, so we recognize that. The thing, particularly with the Tuskegee syphilis study, is after that happened and it was discovered that people were being denied treatment, there was all these checks and balances put into the system to prevent from ever happening again. So people that were in these vaccine trials, people of color, they had full informed consent. They walked people through what to expect, not to expect. And so right now we're at a point where we have a possible solution out of this pandemic, but we still have some people that may be nervous or don't trust. So I think the important thing for us is to put out the information, the facts, answer the tough questions. No matter what the question is, we have to give you an answer. You should be able to trust it. So when you ask a question, I can back it up from a trusted resource. And then to me, where I look at it is, if you have the information, all the right information, you should be able to make your own choice about getting the vaccine or not. I hope that you will make the choice to get it, but you're an independent person. But make sure you get the information from trusted, reliable sources. The State Health Department, the CDC, the Jefferson County Department of Health has the information. So we're also engaging with the community, just like conversations right now. Tell us, what information do you need to have to make the best choice for yourself? And then if you have questions or you're hearing rumors about stuff, ask us and we'll get to the bottom of it and try to give you the facts as we know them.
All right, I know another thing too, a lot of times you've probably heard when people say another myth is that, okay, well, even if I get this COVID-19 vaccine, it ain't gonna stop me from getting COVID. So I've heard that the last couple of days or weeks when this vaccine was rolling out, that I've heard, from a couple sources, they'll say, well, if you get it, you'll still have it in you. You still can't transmit it. Can you kind of clear that up? What the vaccine actually does?
Yeah, so that goes to the vaccine effectiveness. So I told you it's about 94, 95% effective. So what they did was, this is in these research studies, the thousands of people have gone through this. They got the first dose, waited anywhere from 3 to 4 weeks later, and they got their second dose. And then after that, they followed these people and they said, well, did you develop COVID from just general community exposure?
Mm-hmm.
So you have two groups of people. You got one group that got the placebo fake shot, and you got the other group of people that got the real shot. And you're still going about your normal business because you're in a vaccine trial, but you're working, you're going about your business. And then the people that got the vaccine, that 94% of those people, 95% of those people did not get COVID during a certain time frame, but the other group did. So that tells you the vaccine works. What we don't know yet is how long that protection lasts for. It's at least probably 3 months. I don't think 3 months is good enough, but we need more time because remember, these trials are still ongoing. So we're hoping that it's going to be sustained for months and months and months and months. So the vaccine works. The data shows it, and you're talking about 95%. That's better than the flu shots that we still encourage people to get. They may be any given year 50, 60% effective. This is something that's 94, 95% effective.
And so now we're talking about the flu shot. A lot of times, your office and health institutions also have been pushing to make sure you get your flu shot in the midst of the COVID-19, because I heard the news today about somebody very well known here in the Birmingham community that do events passed away from complications from COVID, but they also had the flu at the same time.
Yeah.
Can you kind of tell, I know we're only talking about COVID-19, but the importance of getting the flu shot in times like this, especially?
Yeah. So your immune system can only take so much. It's trying to fight off any kind of infection. So if your body has to try to fight off possible COVID and flu at the same time, you're rolling the dice on that one, right? Your body is only but so much it can handle, right? So we don't want your body to have to fight two infections at the same time. And you can have both at the same time. It's not as frequent, but it can happen. And the other issue is from a bigger kind of community kind of perspective. So our hospitals are overwhelmed. Our ICUs for COVID are filled up. And if the hospital had to also deal with a bunch of influenza cases, then it could potentially, I don't want to say shut the hospitals down, but basically the hospitals will almost be crippled to the point where the hospitals will have to go send people outside of our area to a hospital further away because they don't have enough space. So we don't want to strain the system to have COVID plus flu going crazy at the same time. So you don't want it in your body and you don't want it in the community, generally speaking.
What do you say to people who say, let's do the pandemic Hail Mary? And what I mean by the pandemic Hail Mary is this whole notion of herd immunity. Let's just, don't try to, do no shutdowns, no masks, anything, and this thing will obviously just disappear on its own.
Well, one, I gotta tell you, with all due respect to those people, it's short-sighted, right? There's been countries around the world who've done that as an experiment and they failed at it. So basically, if you're going to get to herd immunity, that means you got enough of us that have the immune system protection that the virus can't attack. It can't find a target to attack.
Mm-hmm.
So you just let this play out, you're going to have people that are unnecessarily getting it, going to the hospital, being in the ICU, dying from it, as you're trying to get enough people infected with it. So you could try that game, but you're going to have people dying unnecessarily, more than what we're having right now. Now, the safest way to get herd immunity is through a vaccine. So the vaccine tricks your body basically to say, start making those protective antibodies as if you really got infected, but it's really the vaccine is tricking you to start doing that. So then you get the benefit of the immune system protection without the risk of having unnecessary death. But so that is what should happen. So right now we got to protect the people that are vulnerable. There's also people in our community that can't get vaccinated because they have some medical condition that they just can't. Right? So we need enough of the community to step up to get vaccinated to protect the people that can't get the vaccine.
All right, and then like another thing too is I've heard this too. Social media. As soon as I get this vaccine, no more masks. I can go about back to normalcy. What do you say about that myth?
No. So I was telling you, this one thing that we have to figure out. So with the vaccine, right? So we get the vaccine, that should protect us from getting infected with COVID. What we don't know though is, could it protect me, but COVID could still get into my system and then I could pass it to another person. So we don't know if the vaccine stops you from passing it from one person to another. We do know it will protect you from getting it yourself. Okay. So if you potentially could still pass it, we haven't figured it out yet. We need more research about this. That's why you still got to wear the mask. Also, we need to get to that kind of at least 70% of people getting the vaccine. So we still got a lot of people that are saying, I'm going to wait a little bit longer. Maybe I shouldn't get it. So we have to use all the tools to get enough protection. So the vaccine is a really huge tool to try to stop this, but it's going to take a while to go through this whole process and get everybody vaccinated. So in the meantime, you have to still protect the community by doing all the things we've talked about for all these months.
Okay, I don't know if I'm trying to look into like a crystal ball, but based on the way things are now, as far as getting the vaccine, we had Pfizer and Moderna this week. At what point, maybe March or April, do you see it going public wide that anybody can go, to a health facility and get it?
Well, yeah. So we're going to go through these phases now. It's going to take a couple of weeks. Remember, people currently need 2 doses of the vaccine. So the frontline healthcare workers, we got to make sure we got enough of them vaccinated, give them the opportunity. And then you got to wait for like a month because they got to get their second dose. You got the EMS providers who transport people to the hospitals, an ambulance, that kind of stuff, right? Then after that group, that's when we are going to move at some point down to people that are older than 75 years of age, and then people that are older than 65 that have a chronic medical condition. So as you keep on going through this, it takes a while until we feel that we can move on to the next level. So by the time we get to the point where anybody in community can get it, doesn't matter if you have diabetes or not, that's going to take months. And at the same time, remember, we got to wait for more supply to come in. So these drug manufacturers, they're making the product, but it's going through the whole United States. So we got to get more production so it gets pushed into the state. And then we got to make sure that we prioritize the limited doses we have for the people that are most at risk. So it takes a while. So I think April might be something to think that it might not be until April until we can open this up to anybody and everybody.
Okay. And finally, I guess, I'd be remiss if I didn't mention this, because this has been the main reasons why I've been, seeing your PSAs, you and Dr. Williford and other people from your office, is what some ways people can stay safe during this holiday season? Because as much as we don't want to encourage gatherings may happen or potentially can happen.
Yeah. So, okay. So the most important thing is do not spend your holiday times with anybody outside of your immediate household who lives in the house with you. Okay. Now, we said similar things, maybe not as strong, but we said similar things during Thanksgiving. And we just strongly discourage from people from going and visiting other people, having other people in their home and that kind of thing. And we know that people still said, okay, we hear what you're saying, but I'm still going to have my holiday celebration anyway. And look where it has gotten us. So we have now 500 something cases per day in our county. Hospitals are filling up. Now it was going up before Thanksgiving, and Thanksgiving just added fuel to the fire. So we've been there, done that. Every major holiday, we've seen this spike. We're already at all-time highs right now. So I can only imagine what the numbers would look like after Christmas if we don't do this. So we have to now change what we've done before because we didn't do it right. So the only new thing is don't do it. And like I said, is everybody going to listen to me? Is everyone going to do what I said? No, I know that. So, we're getting a lot of transmission of the coronavirus from close contact for people that you probably, you're letting your guard down. So you're inside the home. So, hey, I'm with people that I'm familiar with. I know them. So I take off my mask. I'm not washing my hands. I'm sharing, passing things amongst people. I'm playing games, that kind of stuff. That's why it's spreading. So you have to assume that everybody who's not in your household has COVID-19. And so if you invite someone to your house, think about this in your mind. Do I want to, if I know that you had COVID-19 currently, would I tell you to come to my house to hang out? If the answer is no, then you shouldn't let anybody out, even if they're a relative that lives down the street from you. They don't live inside your household. So that's really the short answer. And it's really not a substitute for that. Everything else we said is still on the table. Social distancing, hand washing, cough etiquette, face mask, all that still applies. But we're saying do all that, plus don't share the holidays with somebody outside of your household.
All right. And I guess I hate to say it's over again, but any final thoughts? Because I'm so happy to have you, here answering these questions. But anything you want to tell people that you haven't had a chance in the PSAs or, the interviews to tell the public? So
when this whole pandemic started, I want people to think back, right? And when it first started, we were scared out of our mind because we saw what was happening in China. It was spreading around the world. And then when we got our first reported case in the United States, we started panicking, right? And then when it hit Alabama, we really got nervous. We had a healthy respect for the virus and what it can do. And we need to have that same mindset now, right? But at that time, what did we say? We said we had to flatten the curve, and we're buying time until we have a safe and effective vaccine. This whole time, that's the end game, is getting good, safe and effective vaccine. Now, we have safe and effective vaccines. So now we can't make excuses. And I understand we still got work to do to make sure people feel comfortable and know that this is safe and effective. And, so that's part of the cross we got to bear. We got to educate. But we're at that point where now it's up to the community to say, if I'm tired of wearing masks and I'm tired of social distancing and I'm tired, of lockdowns and all this stuff, my question to you is, how do you get out of this mess that we're in? And the only out is to do all the recommendations plus get a vaccine. That's it. There's no other tool we have to get us out of this thing. So then you do a gut check and say, what am I going to do to be part of the solution? Because I'm sick and tired of COVID-19 myself. You're sick and tired of it. I'm sick and tired of it. What are you going to do different to change the game and get us out of this pandemic? And you can't rely on someone else to do it. You got to do yourself. What are you going to do? And everything you've done this far, we're still at the highest levels. So that's still not good enough. So the vaccine is the only other thing on the table.
Okay. Well, Dr. Hicks, thank you so much for coming on the podcast. You're more than welcome to come back in the future. We're going to need you to, continue to get this information out, especially with the vaccine rollout, letting everybody know, where we can go get this vaccine. Because I agree with you. Like, that's the only end game, really, right now. There's no other way to kind of get out of this health epidemic, pandemic, whatever they call it. And also on a personal note, thank you for supporting my podcast and everything. And, I hope I do a good job for you all and everything.
Yeah.
And everything. So thank you all for watching this video today. Please check out what'shappeningbirmingham.com for more videos. Please check out the Jefferson County Department of Health website as well. You'll see the little text on the interview where you can go and you can get, minute-to-minute health updates. They have the social media channels, also text messaging, whatever case may be. Thank you all again and have a great day. Bye-bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.